I'm Naveen Kumar from Army College of Medical Sciences. The topic of my talk is cubital fossa. It is a triangular space situated in front of the elbow and it is homologous to the popliteal fossa of lower limb. Boundaries of cubital fossa. Laterally, the boundary is formed by the medial border of brachioradialis. If we semi-pronate our hands, the muscle which is prominent is the brachioradialis muscle. Medially, the lateral border of pronator teres forms the boundary and it is directed like this. The base of cubital fossa is formed by an imaginary line which is joining the two epicondyles of humerus. If we see in the humerus of right arm, the two epicondyles and the line joining them forms the base of cubital fossa. Apex. Apex of cubital fossa is directed downwards. Pronator teres and the line and the meeting point of brachioradialis forms the apex of cubital fossa. Roof. Roof of cubital fossa is formed by skin followed by superficial fascia which is containing the medial cubital vein. As we can see in our subject, the medial cubital vein is clearly prominent and is clearly seen. The other structures in the superficial fascia are lateral and medial cutaneous nerves or fora. Below it is the deep fascia and further below it is the bicipital epineurosis. Floor is formed by brachialis and supinator. Brachialis is a muscle which is directed from the shaft from here toward the ulnar tuberosity on ulna, and supinator is another muscle which plays an important role in the movement of supination, which is a movement like this. Cubital fossa holds importance due to its contents. The contents of the cubital fossa from the medial to the lateral side are as follows. Medially is the median nerve followed by brachial artery, then the biceps brachii tendon along with the bicipital epineurosis, and finally the radial nerve. As we can see in this diagram clearly represents the elbow of the right elbow and the contents of the cubital fossa. The structures here are: most medially is the median nerve followed by brachial artery, and this is the tendon of biceps brachii, and part of it forms the bicipital epineurosis over which lies the medial cubital vein, and most laterally is the radial nerve. Applied aspect is the most important part of cubital fossa. We feel the brachial pulsation by putting our three fingers in a semi-flexed elbow medially to the biceps brachii tendon. And here we feel the pulsations, and this is also used for recording the blood pressure by auscultatory method. Medial cubital vein, as shown already, is used for the intravenous injections. Thank you.